This is the update as of May 20. There is limited testing, making it harder to assess the situation. Vaccine fading and reinfection has been added to the BA2 surge. We also estimate the peak to be in June, though reinfection could lead to another follow-up surge. Increase in hospitalization is due to the current surge and high transmission, though no significant surge in severe cases. The 7-day average for test positivity continues to go up in all counties. Only Maui and Kauai appear to be going down, but only after they had reached near record highs. The 7-day average for test positivity is currently the highest throughout the entire pandemic, except for the Omicron surge at the beginning of 2022. This is a comparison of test positivity for the Delta in green, Omicron 1 in red, and Omicron 2 in purple, all starting from about 5% positivity that is often correlated with a swell in cases. The current strain is between Delta and Omicron 1 for Honolulu and Maui, closer to Delta for Big Island, and more like Omicron 1 for Kauai, indicating something different may be happening. These were the number of tests that were conducted where mandatory testing for the previous surge led to a higher number of tests. Higher positivity now leads to fewer infected individuals than before, with testing being biased towards those who are already suspected. In this model, Omicron BA2 is included as a competing variant. Vaccine fading is included as they lose their effectiveness, and the possibility of reinfection has been added. The modeling diagram is shown on the right where the red arrows represent the last two features. Now, there are several challenges in the modeling, such as with limited testing, uncertainty in defining hospitalizations with COVID-19, and that it no longer makes sense to fit daily cases. Our model aligned with CDC's latest findings with the estimates of the percent of the population that was infected on April 15, 2022, with 60% for Honolulu County, 58% for Hawaii County, and 59% for Maui County. The variables of total new infections, daily new cases, active hospitalizations, and total active infections on vaccinated individuals are defined. The daily cases and hospitalizations may not fit the DOH numbers due to limited testing and a difference in the definition for COVID-19 hospitalization. In Honolulu County, the model has safe access and travel removed along with masks. Reinfection and vaccine fading has been added. The cumulative number of infections for the county, including reinfections, is estimated to be 745,269 as of May 20, 2022, where most cases are asymptomatic or with mild symptoms. With the surge and vaccine fading, the total number of new infections for vaccinated individuals and the total new infections that will remain asymptomatic are decreasing. Hospitalizations are increasing, with 1.2% of ICU beds occupied by COVID-19 patients and 3% of patients on ventilators being COVID-19 patients. These are the current parameter assumptions and their descriptions for the updated model for Honolulu County. We assume that BA2 was introduced to the county on December 20, 2021. These are the estimates from the model of the cumulative number of infections since May 6, 2020, with 745,269 infections as of May 20, 2022, a relative increase of 15% from May 6, 2022. The estimates for May 12, May 20, and May 30 are also broken down into new infections, cases, asymptomatic infections, and infections on vaccinated individuals. In the forecast for Honolulu's daily new cases, the model estimates the peak to occur during the first 3 weeks of June within the range of 3,500 to 4,300 cases. Hospitalizations are estimated to peak in the second half of June within the range of 225 to 250. The model for Hawaii County also has masks and safe travel removed with the addition of reinfection and vaccine fading, and estimates the BA2 variant to be quantifiable in Hawaii County about the same time as Honolulu County. The model estimates 142,497 cumulative infections on May 20, 2022. Hospitalizations are increasing where 11.1% of ICU beds are occupied by COVID-19 patients, and 7.7% of patients on ventilators are COVID-19 patients. The hospitalization parameter of estimating stage 3 and 4 was increased, though it is unclear whether hospitalization due to COVID-19 was a primary or secondary reason. These are the current parameter assumptions and their descriptions for the updated model for Hawaii County. We assume that BA2 was introduced to the county on December 20, 2021. The model estimates the cumulative number of infections to be 142,495 infections as of May 20, 2022. The estimates for May 12, May 20, and May 30 are also broken down as before. The model estimates for the peak in daily new cases to occur in the first week of June within the range of 300 to 450 cases. Hospitalization numbers are estimated to peak in the second half of June within the range of 25 to 30. The model was updated for Maui County with masks and safe travel removed and addition of reinfection and vaccine fading. It estimates that Omicron BA2 was quantifiable in Maui County a week later than Honolulu and Hawaii County. The estimated cumulative number of infections as of May 20, 2022 is 109,221. About 11.1% of ICU beds are occupied by COVID-19 patients, with no COVID-19 patients on ventilators. The hospitalization parameter for the estimates was also slightly increased to account for the increase in hospitalizations. These are the current parameter assumptions and their description for the updated model for Maui County. We assume that BA2 was introduced to the county on December 27, 2021. The model estimates the cumulative number of infections to be 109,221 infections as of May 20, 2022. The estimates for May 12, May 20, and May 30 are also broken down like before. In the forecast for Maui's daily cases to May 30, 2022, the model expects the peak to be during the second part of June with daily new cases within the range of 200 to 400 cases. Hospitalization numbers are estimated to peak in the first half of July within the range of 25 to 35. The model for Kauai County estimates 65,453 cumulative number of infections, including reinfections. No ICU beds or ventilators are occupied by COVID-19 patients. The hospitalization parameters for estimating were increased, though the reason for the increase is unknown. The model estimates the cumulative number of infections to be 65,453 infections as of May 20, 2022. The estimates for May 12, May 20, and May 30 are also broken down as before. The model estimates the peak to occur in the first half of July, different from the other counties. This is due to Hawaii having the largest relative surge during December, with reinfections resulting in higher counts in June. Hospitalization numbers went up suddenly, which cannot be accounted for by the model, so the reason is unclear. We then looked at influenza cases where we found an increase in the past few weeks. In these graphs, we see the number of influenza cases and percent positivity over the past 4 years in Hawaii. In 2019 to 2020, it was headed toward an even more severe flu season than 2018 to 2019, as seen with the high positivity. There was then a dramatic decrease in 2019 to 2020 and 2020 to 2021. Likely due to COVID-19 restrictions. However, as restrictions have been lifted, we see cases and positivity picking up for the 2021 to 2022 season, even though it is during a time when we usually see numbers fall. This shows the influenza vaccination rate for adults in Hawaii from 2012 to 2020. We see a low vaccination rate in 2018, which corresponds to the high case counts in the 2018 to 2019 season. However, we also see vaccination rate increase in 2020, and if Hawaii continues with the rising trend, we may see influenza cases decline.
HiPAM gives our sincere thanks and appreciation for their feedback and interest in these voluntary forecasts. We do so with humility, respect, and gratitude for everyone during these challenging times. As always, we invite your feedback, collaboration, and partnership.
Created using Powtoon.